Dear students, welcome to Bluepen Online. Shall we begin? Please use headset, pen and paper to take notes.
Here you go. Please let's know your feedback after class.
The presence of an oral habit is an important finding during the clinical examination, especially in 3 to 6 year old child. Oral habits may be a part of normal development or a symptom with a deep-rooted psychological basis that may be the result of abnormal facial growth. If a habit that causes dental changes is not eliminated before permanently erupt, they will almost certainly be affected and induce harmful unbalanced pressures, especially if there are immature ridges, which can result in change in position of teeth and occlusion. Parents seek treatment because these habits, especially digit or pacifier habits, become less socially acceptable as the child becomes older. Persistent habits in older children may also have psychological implications. Coming to the definition of oral habit is defined as a fixed or constant practice established by frequent repetition. Matheson defined oral habits as learned patterns of muscular contractions, and according to Finn, it is an act which is socially unacceptable. So please do remember the definition of habits. This is important. Coming to the classification of oral habits, there are various classifications given. Here we will discuss only a few important ones. There are around 11 classifications. So the main important classification include, one is given by William James. So James defined oral habits as useful habits and non-useful or harmful habits. So the word useful habits means it includes all habits of normal function. So nasal breathing, deglutition, correct tongue posture are the useful habits. Non-useful or harmful habits include those which exert pressure or stress against teeth and dental arches. So these are mouth breathing, lip biting and lip sucking. Kingsley's classification. He classified based on nature, like functional, which include mouth breathing, muscular including tongue thrusting, combined muscular habits, thumb and finger sucking, and postural habits which include chin propping and abnormal pillowing. Morris and Bohana have given classification as pressure habits, non-pressure habits and biting habit. So the pressure habits are thumb sucking, tongue thrusting, non-pressure and mouth breathing. According to Klein, oral habits are intentional or unintentional. So intentional or the meaningful habit is mainly because of any deep-rooted cause. Unintentional or the empty habit, it will not have any deep-rooted cause, but because of the frequent repetition, it has resulted in habit. Finn classified as non-compulsive and compulsive. Non-compulsive are those habits which are easily added or dropped from the child's behavior pattern as he matures. Compulsive habits are which are acquired and express a deep-seated emotional need. The habit has acquired a fixation in the child to the extent that he retreats to the practice whenever his security is threatened by events. According to Tandon, the classification is obsessive or non-obsessive. Obsessive is again classified as intentional or meaningful, like nail biting, digit sucking, or masochistic or self-inflicting injurious habit, like gingival stripping. Non-obsessive classification, empty or unintentional, of the functional. So the empty habits, chin propping and abdominal pillowing, and functional mouth breathing. Coming to the etiology of oral habits, so there are various etiology behind every habit, but in general, the basic etiology include overprotection, loneliness, isolation, pain and discomfort, abnormal physical size of parts, imitation or imposition of others. So this might lead on to a development of habit. This can also be occurred due to some family conflicts, jealousy, school pressure, stress of large city, lack of satisfaction through nourishment, then occlusal interference, breathing obstructions, etc.